If that left leg is driving forward, I would expect to see this hand moving in space a little faster than his other side. So both hands my hands are going to move forward in space. Because this left leg is driving it, I'd expect to see this happen a little bit. And I can see, is it happening? And it doesn't look like it's happening a ton to me. I could put my hand on his pelvis and also on his femur, and I would expect to see that happening. Maybe it's happening a little. I don't know. What I really want to do is compare it to the other side. So we're going to switch sides here. Right foot forward, left foot straight ahead, standing tall. As you're doing this at home, get into the position that the patient you're assessing is in, okay? Get up in their business. I don't want somebody assessing it back here as they're doing it. If his right forward's forward, my right foot's forward, and we're getting into this position, I'm up in his business here, okay? I can feel a little better. And I don't know if you can see it here in the camera, but as he drives that right leg forward, I feel like his right pelvis is moving forward faster than his left pelvis, which is what I would expect. I think you could probably see that. If I put my hand on the tibia or femur, you could see that there's some rotation, but it's not as fast, okay? So that would be the normal motion that I would expect to occur here, okay? Let's face that way here for a second, Eric. Same foot forward, right foot forward. I can look at the sagittal plane here as well. I could put my hand, stand up real tall. I could put my hand on his pelvis and my hand on his femur as he drives that right foot forward. I would expect to see both my hands moving forward in space, but I would expect to see my top hand moving forward faster than my bottom hand. And it, again, it looks like it is, but again, I want to compare it to the other side. So let's turn around here and let's put your left foot forward. Okay, so I could hand on the distal femur, hand on his pelvis, go ahead and drive forward. And you could see pretty clearly here how my hands are moving at the same speed right here. He actually wants to flex his knee slightly as he does this. So this is not getting a sequential dissociation. These are two bones moving in the same direction right here. If I wanted to do a sagittal plane correction, my assessment, as Gary Gray says, that a test turns into exercise, as exercise is test, you're going to keep moving. I'm just going to speed up the top bone a little bit. So I'm just pushing the top bone right here a little farther forward faster than the bottom bone. I'm slowing the bottom bone from moving forward in space. Recognize that thought there. I'm not pulling his bottom bone backwards in space. I would expect it to move forward, but I would expect to make it happen slower than the top. So I'm just sort of trying to make that happen.